Chronic pain is the biggest health burden worldwide, but most of us don't realize just how many people are affected by chronic pain. 1 in 5, or about 1.5 billion people, suffer from chronic pain. Chronic pain can interfere with every aspect of a person's life: work, relationships, self-esteem, and emotional well-being. Back pain, headache, or post-operative pain, and even pain without a physical source. I'm a healthcare psychologist and therapist, and I make videos on psychology and mental health topics. And today's video is all about chronic pain. Pain is our body's normal reaction to an injury or illness, a warning that something is wrong. When our body heals, we normally don't feel pain anymore. But if the pain has not gone away or recurs frequently even after 6 months have passed, we call it chronic pain. While the pain may not be constant, it is the dominant fact of life for many chronic pain sufferers. It's not uncommon that chronic pain is disproportionate to the severity of an injury. Certain injuries do not even involve any pain, for example, words. And there is also pain without injury, like you can also have a headache without bumping your head. This is because pain is not only a sensation, but also an emotion that manifests itself in a particular context. We perceive every feeling of pain in the brain. How much pain we feel depends on the attention we give it and the stress we experience at the time. Do we expect pain? Are we afraid of it? If so, then we will also feel pain. Research has shown that the pain is worse when we expect pain. We unconsciously hinder the natural pain relief in our brain and spine. This will also happen if we think the pain will get worse. Negative expectations thus cause more secretion of cholecystokinin. This is a substance that makes pain transfer easier. Those who are focused on their pain and worry about it experience the pain more intensely. These pain patients pay attention to their bodies all the time. They fear that something bad will happen to them and think there is nothing they can do to feel better. They are also often afraid to move and thus develop a disability called kinesiophobia. A person who avoids pain ends up in a vicious circle, because if we confront the pain without fearing it, we heal. But if we want to avoid the pain, we become overly vigilant and we don't heal well. Pain can permanently change the connections in our brain. This can lead to anxiety, depression, and cognitive problems. Brain scans have shown that this is associated with a change in the volume of certain pain centers in the brain. A combination of factors causes the pain to disappear or to become chronic. These factors are the cause of pain, the context in which pain manifests itself, and personality. Scientific research supports the idea that pain can become chronic if the neuronal pain circuits store a memory of that pain. Imagine you burn your finger. A pain signal from the nerve cells in your finger is sent to the nerve cells in the spinal cord. They send the information to the brain. Processing in the brain causes you to feel pain and pull your finger back. In case of chronic pain, those pain messages are reinforced because they have gone through an electrical and molecular learning process. This is called a molecular storage mechanism of long-term information. How strong this memory trace is and how long it lasts depends on complex mechanisms, in particular the synthesis of multiple proteins. But if you stop abruptly with painkillers, it can cause uncontrolled pain. This can also happen due to intense or prolonged mechanical or thermal pain. For example, from intense heat or a damaged nerve as a result of surgery. Post-operative pain is not just annoying or unpleasant. If it's not treated correctly, it can sometimes become chronic pain. In this case, a hypersensitivity of nerve cells or neurons that transmit the pain stimuli develops. This creates a pain memory. Although the patient is under anesthesia, his nerve cells are stimulated by the procedure and can remain very active afterwards. Anesthesiologists use high doses of morphines. They are effective in the moment, but they sometimes have the opposite effect in the long run. If the patient has to undergo a second operation, he will only feel even more pain. Today, anesthesiologists try to stop the transmission of nerve impulses by using local anesthetics in combination with sedatives or adding medication such as ketamine. As a result, the dose of morphine can be limited. The second mechanism of postoperative pain is a consequence of the operation itself. The doctor sometimes damages the sensory nerves, which can react abnormally and produce feelings of pain. This type of pain is called neuropathic pain or nerve pain. Nerve pain can be treated medically. For example, with a certain type of epilepsy medication or with an antidepressant. If doctors cannot help, psychotherapy can help to relieve chronic pain. Hypnosis may be a helpful non-drug therapy to reduce pain. If the person regularly practices hypnosis, pain circuits in the brain change and the pain lessens. Prolonged practice of self-hypnosis on a regular basis is the key to success. The more you practice, the better you can change your pain sensations. I have already posted a pain relief hypnosis script on my channel. Cognitive behavioral therapy is another therapy for chronic pain. It is effective for anxiety and depression as a result of pain. It teaches pain patients to better manage their pain. CBT can be helpful for chronic pain by changing the way you think about pain and to develop different behaviors in order to tolerate and manage the emotions that elicit and amplify pain. Among other things, work is being done on avoidance. If you experience pain and perceive it as a threatening, you become anxious. The fear avoidance model describes how chronic pain patients can experience more pain as a result of avoidant behavior based on fear. Negative beliefs about pain and its consequences may result in feelings of pain-related fear and avoidance of daily activities. As a result of this misconception, people avoid pain-inducing activities and are likely to overestimate any future pain from these activities. In turn, the avoidance results in physical deconditioning, a feeling of powerlessness and depression. The pain persists or even gets worse. CBT helps to break this vicious circle of pain avoidance. Because if you don't think catastrophically when you are in pain, you'll usually quickly resume your daily activities and recover quickly. An effective coping strategy will not reduce the intensity of the pain, but it will increase pain tolerance. Effective therapy components are learning to distract attention from pain, relaxation exercises, self-hypnosis, mindfulness exercises, finding a proper balance between activity and rest, and so on. If the patient does not believe that he or she can change, his behavior, no therapy will work. Hopeless pain patients seek ultimate relief from pain. They go to all kinds of therapists and take too many medicines. But if you try with all your might not to think about your pain or feel it, you'll just perceive it more intensely and become overwhelmed by negative feelings and catastrophic thinking. Therefore, the main goal is not to reduce the symptoms as it used to be, but to learn to accept pain. A form of psychotherapy called acceptance and commitment therapy is based on this idea. The motto is, don't wait for things to get better to do what's important to you. Some pain patients may also benefit from treatment for post-traumatic stress, PTSD. That is not so strange because neurobiological similarities have been found between chronic pain patients and PTSD patients. Therefore, EMDR can be the treatment of choice for pain patients. Due to unprocessed trauma, most stress hormones are released in the body. As a result, the limbic system, involved with emotions, becomes overactive. The ongoing chronic pain is also characterized by increased brain activity in the limbic area. EMDR decreases the activity of the limbic system. All the mentioned therapies have the same goal: to give the patient a sense of control when it comes to his health. The goal is not to remove the pain, it's often impossible, but to reduce pain and to improve the quality of life. The goal can be to teach people to experience pain differently, to become more active, and to focus on important things in a person's life. That's all for today. I hope you enjoyed this video and learned something new. If you did, give it a thumbs up, it really helps the channel a lot. Don't forget to hit that subscribe button and the notification bell before you go. Thank you very much for staying with me. See you next time.